First of all, welcome everyone. I see Oselu, I see Betty, Godfrey, Timmy. Um, I see a newcomer, two newcomers actually. So I'd just like to welcome you guys to today's webinar. So I'm just going to read a welcome message that I put together. Hi everyone, and welcome to the Digital Healing, the Rise of Smart Care. My name is Shanice, and I'm excited to have you all here today. This is a space for youth to explore how artificial intelligence is transforming healthcare and how we can be a part of that future. We've got amazing speakers lined up and a breakout challenge, and yes, there is a food voucher to be won from Rocco Mamas, so participation is a key to getting that voucher. And stay engaged, drop your thoughts in the chat, and let's make this session unforgettable. So before we get into it, I just have like a few rules. So I'm going to ask everybody to just have their mics muted. And then when we get to the Q&A session, if you want to ask a question out loud, you can raise your hand and then you can unmute. And stay present, be engaging. We want to learn from you as much as you can learn from us. And yeah, that's pretty much it. So we'll just jump right into our first speaker, which is Timmy. So I'm going to hand it over to Timmy to just give us the first talk of the day.
Thank you, Shanice. Appreciate that. Yeah, let me just do some stuff here. Yeah, thank you, Shanice. Really appreciate the opening and also for making us have this session together. Just firstly, am I audible to everyone?
Yes.
Okay, thank you. Yeah, so once again, thank everyone for being here. And yeah, I am Timmy. I am the lead marketer, more or less, of Eden AI. And I just want to welcome you all here because just let everyone know that in AI isn't just a future thing, isn't just something that people look at for the future. AI is currently happening now. And this time is a time for us young people, because I'm just 26, and I don't think there's anyone here that's even close to 40 years old, which lets you know that it's not just a thing of the older generation. It's not just a thing of our parents or our grandparents or even our older siblings. It's a thing for us now and here. As we are here together, we can learn from each other. I know that most people look at AI, they think of generative AI, they think of ChatGPT, they think of getting assignments done, getting essays written down. They think of making memes, making pictures. But AI is more than just that. AI is more than just memes, it's not just pictures. AI is actually saving lives, actually making a massive difference in the world. And the one we want to focus on right now is healthcare, because when you think of AI, you think of ChatGPT, and it's very hard to wrap your head around going from ChatGPT to healthcare, which everyone sees as doctors, everyone sees as, operations, cutting up open. How can what I used to do my homework translate to, saving lives and helping people? And that's actually what I want to talk about right now. I'm just gonna share my screen so you can all just have a visual of what I'm talking about. Yeah, can you all see my screen right now?
Yes.
Okay, great. So right now, we're going to talk about AI saving lives. As of right now, there are 4.5 billion people around the world that still lack access to essential healthcare services. And by 2030, we face a global shortage of around 11 million healthcare workers. This is an enormous challenge that, as you can see, that's 11 million doctors that will be needed that we won't have. And that's 4.5 billion people that need healthcare that won't have that. And there's a global population of 8 billion people now. So that means over half the world lacks essential healthcare services. We're not talking about private elite stuff, we're talking about essential things that they need. And that's a massive problem. But fortunately, AI is already offering a chance for us to close that gap. not just close the gap, also reimagine healthcare as a whole. For instance, AI, there are many AI softwares that are out there helping doctors do their jobs faster and more accurately. For example, there is an AI software that can help human experts look at the brain scan of a stroke and be able to easily identify that. And it doesn't just spot the stroke, it can tell doctors when the stroke happened, which is critical for deciding which treatments will work and which treatments will not work. And there are even AI in emergency rooms that are spotting bone fractures, that are helping urgent care doctors get cases that they miss in up to 10% of the cases they have. Oh, sorry about that. Flip. Apologize for that. That was technical difficulties on my side. Yeah. 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 Doctors are in 10% of the cases that they miss in those cases. And yeah, healthcare is even, it's also helping paramedics and paramedics in the UK solve some problems as well. And a recent study showed that AI can correctly predict what patients need up to 80% of the time, which saves time, money, and most importantly, lives. Yeah, AI is being used to predict diseases years before symptoms appear by analyzing, history and many things that happen. But most importantly, it's being used in cases like Alzheimer's and kidney diseases, or even COPD, where when you get them early enough, it could be the difference between life and death for those people. There are new systems like ChatRWD that combine language modules with retrieval systems. Humor has been shown to cut down hospital readmission for up to 30% and save clinicians 40% of the time they'll need when reviewing patients. And yeah, many more things. But the thing is that these things aren't being done by 40, 50, 60-year-old men. These things are being done by new coming devs, people who are in their 30s, people who are just young, who are up and coming. These are things that are being done by them. These are things that are saving lives, revolution in healthcare, showing people different things, and they're being done by people who aren't much older than, who are the same age or not even much older than all of us here. It just shows that AI and how AI can save lives. And the thing is, AI isn't just modernizing Western medicine. It's also enhancing traditional medicine. Like in India, AI is cataloging centuries of knowledge to find new herbal treatments for modern diseases. And in Ghana and South Korea, researchers are using AI to classify medicinal plants and analyze traditional components to treat blood disorder. Because as we know, there are many different knowledge you can find with traditional healers, traditional healing, traditional practices that many people might ignore based on going for more modern alternatives. But with AI, we can actually analyze those things, analyze that knowledge, analyze the plants, analyze everything around them, and find out the things our ancestors knew 100 years ago, and use AI to bring them in a way that we'll understand now, to fully analyze their treatments, fully analyze everything they do, and be able to let us know this is how AI is being used, this is how AI can help revolutionize us. And beyond that, these are other ways that AI can be used to improve healthcare and save lives. For instance, the continuous observation of chronic conditions. AI tools are effective at tracking large amount of data, especially patient data going around that regular doctors, even humans can't handle. For example, Medtronic's Sugar IQ app monitors blood glucose levels and sends real-time messages to users, helping them understand exactly what their food choices is doing and what they can use for insulin when they need to use their insulin, so that they don't have to constantly be worrying about when it has to happen, have a tracker. They can just have in real time know that based on this you have to take in, you need to use your insulin in this time. Diagnosis and research are also being affected by AI because what yeah, because AI can analyze chronic non-communicable diseases like diabetes, cancer, heart disease, respiratory illnesses, which account for up to 70% of the world's death. and they can detect it earlier and begin figuring out the treatment plans and figuring out how to help the people out. And not just with that, it's also helping with drug testing and development, where it can analyze, like we said, either either analyze traditional healing methods to figure out what can work best in the real time, or even look at different diseases as they're progressing and find out the best drug that can target each individual person in that stage that's going on right now. It's also majorly developed for helping developing nations keep up with limited healthcare access, because in America, you can have a lot of resources, but then if you want to take a solution that's working in America and bring it to a country like, let's say, Chad, the DRC, Congo, those kind of countries, you need to have a lot of team. They don't have the infrastructure, they don't have the training, they don't have any of that can help them work the way America works. But with the right AI tool and the right AI technology, they can actually begin to work in that same level, because the AI can analyze the differences, analyze what's needed, and even then start creating possible solutions that can be used to bridge the gap between what's there and what we need. AI can also help with critical care settings. For example, the University of Florida health researchers are building smart intensive care units that use cameras, sensors, and AI to detect when patients are in need of assistance, even when there is no nurse in the room. That way, nurses don't have to be there 24/7 for one patient to make sure there's nothing going on with them. The nurse can be going to other more critical patients, and when the patients are in critical care need assistance, they can then come back here. And not just for healthcare, but also human trafficking. AI can save lives in human trafficking by analyzing web data, images, criminal networks, and faster than any human team can do that. And it can also analyze it and just go and find out. And when it comes to medication safety, AI can fight this silent but deadly challenge, because drug errors can, in the US alone, claim up to 9,000 lives. And with this, an AI tool can analyze exactly what's needed, the proper dosage that's needed for the right person, and administer that dosage to the right person without there being any variations, as close as possible. As I look at all of this, you're probably thinking that AI and emergency care are a good pairing. Then you're also thinking that, is it really an issue? But is it, they can probably think of the positives, the benefits, and all of the stuff that's going on. But many people, many pessimistic people will start saying that if AI is doing all of this, if AI is doing all of that, doesn't that mean that we're taking jobs from people? And that is definitely false, because trust, AI and emergency care are a great pairing in modern healthcare due to the numerous ways AIs can help medical practitioners in emergencies. But the thing that we should focus on here is that it helps medical practitioners in emergencies. It does not replace them. It cannot replace them. It can only augment their expertise. It can only augment what they do. It essentially, AI, what we do at the end, it just helps people. It helps people be able to do better, be able to work better. For instance, nurses who are focusing on one patient 24/7 to make sure that patient is okay, we can have the right AI tool with them, can go focus on other patients. In other words, meaning the understaffed, overworked healthcare workers that are already struggling to handle the burdens that are on them right now, can have a break to be able to handle other more critical cares. And even more seriously, they can take breaks, they can take more breaks, they can relax, because it said that stress is the number one cause of illnesses and even deaths in the healthcare space. Meaning our doctors and our nurses are genuinely working themselves to death in many cases. And with right AI tool, the right AI powered tool, we can have those doctors, those nurses who risk their lives, who risk their health to save us, have the chance to relax. For instance, let's go back 5 years ago to the COVID-19 pandemic, when it was like every other week you saw on the news that nurses, doctors, health practitioners, they were in the hospital near 24/7. They were constantly stressed, they were constantly there. That I remember seeing that videos and pictures of nurses and doctors just sleeping on beds, sleeping on the place they can get. But if these tools were there that could be implemented then those nurses, those doctors could still be working at the maximum capacity while still helping people to beyond what they could do even now. And another thing is that trust and confidence are not enough for effective human AI teamwork. What it needs is expertise that needs to be doing. Meaning we need trained, targeted people, meaning the doctors, the nurses, they have to be there. They have to be on the ground. They have to be the ones who are using these tools. Because if, for example, with ChatGPT, an example that we all know, if you are using ChatGPT to do your assignment for you and you don't know anything about the subject matter you're doing, ChatGPT can give you answers that are completely irrelevant. It can give you answers that don't make sense. And it's up to you, using your human understanding, your human mind, your human reasoning, to look to the response, the answer you've been given, and go through it to make sure you're not doing anything wrong. You're not using the wrong thing. And for example, a recent study by Grace and colleagues in 2025 illustrates this problem very well. It says that AI was helpful, but not always accurate or consistent. 20% of the teams performed effectively in first aid team, and those 20% were the ones that were told to constantly review the data, could constantly review it. The others were told to just trust the AI completely and work with it, and the others were told to just constantly review what's going on. And in fact, those who are told to constantly review it got the best results ever. This shows that despite how effective and how great AI tools have gotten right now, there's no replacement for human expertise, which is why we also have to continue upskilling ourselves. We also have to continue training ourselves. We also have to continue to improving ourselves. We can't just rely on the tools that are here. They are great tools, yes, but they need us to be able to use them well. Because if we misuse these tools, if we trust these tools and not ourselves as well, we're going to end up causing more harm than good. And so the most important thing that we as individuals have to do is we have to trust the tools, but also upskill ourselves, train ourselves, and do better. And as the future, which is now, comes to fruition, it becomes even more and more critical. And just to showcase something that a case study that will be used is a case study in rural Ghana. Obviously, names and something that have been obscured to make it work better. But there was a doctor who saw response for around 80,000 people spread across the community she was in. Most days, barely could drink. Most days, the line outside the consultation room was seemingly endless. Mothers with sick children, older men with high blood pressure, expectant mothers, expectant, so many. The problem wasn't just the number of patients, it was the way the information was scattered. It was like lab results were here, and then others were based completely on nurses' memories, completely on this person knows that nurse XYZ knows patient 1 2 3 4 5. She knows everything, but then she got sick one day, so now because she's sick, the knowledge she has can be brought back to everyone to help. And this is kind of where AI tools come in, because if all the knowledge that the nurses have, all the knowledge that they have on the patients, they know this patient comes here, this patient does this, if they could pull that down into a new pilot powered AI powered chatbot, if they can have all of that in one system, then it'd be easy to do that. Then any doctor can just come and look at the situation that's going on, bring up the patient's data, bring up the patient's information, bring up the patient's history, medical history, and be able to look at it. And then if the doctor can just have a summary of everything that's going on with the patient, with the patient's history, know what's been done in the past, know what has worked and what hasn't worked. That way, the doctor knows that this patient is going through XYZ. We've already done this solution before and it didn't work. So I want to recommend this solution. I want to look at other solutions that can be used to solve this patient's problem in other places. We can also have that this woman has been pregnant for 8 months. She's due any day from now. The doctor has noticed that she's had some healthcare complications and these medications don't work, or this person has these allergies, this person has that allergies, and then taking that information. That's kind of how AI works, taking all of that massive amount of information that is coming to these all overworked, understaffed people and compiling them in an easy to read, easy to understand way to help them work out. AI is a tool that's to help people, a tool to help continuously improve the lives of those around us, a tool to help the doctors, the nurses, even most importantly, the patients that are continually around these places, these infrastructure, these countries that need it. AI is not a tool to replace, it's not a tool to overtake, it's a tool to assist. That's why most AI-powered chatbots are called data assistants. They assist the doctors with data. They analyze everything that's going on and assist the doctors. So that even when there's 1,000 patients waiting for one doctor to help them out, then we can sort it out to make sure as many lives are saved in as quick a time as possible, to make sure the doctors aren't constantly on death's door at the end of every day, to make sure even if there's a shortage of healthcare workers, that we can continue working, to make sure that 4.5 billion people that are not going to have access to healthcare by 2030 will be reduced to as little as possible, to make sure that in Africa, where we have so much inequalities going on, where we have the very rich and the very poor living next to each other, we can make sure that healthcare is not one of the inequalities that's going to constantly take lives. Make sure that women, children who wake up and go to the hospital can have their problems solved, to make sure that people who are in serious need of help can get the help they need, even if they are not multimillionaires, to make sure that people from the Elon Musk to the woman at the side of the spaza shop can have have the same amount of healthcare love and healthcare capabilities that we can have. And that's kind of what is meant to do. AI is meant to save lives, to bridge the gap. AI is made to save AI is made to prevent these inequalities from getting worse, and AI saves life like that. And as we continue to move forward, as we continue to get to improve technologies, as we continue to go further and further in life, further and further and excel, it falls upon us as the people, us, our generation, our age group, falls upon us to take up that challenge. It falls upon us to see what's going on, take the baton, and then move forward. Because our parents' time has passed. It's currently our time now. And we need to take that, cross, we need to take that challenge on, and we need to, and I know that this is a generation full of intelligent people, a generation full of people who grew up with the internet, who grew up with technology, who grew up learning. I know that as we continue to move forward and continue to excel, that this is a challenge that we can overcome and a challenge that we can take. Yeah, thank you.
Thank you so much, Timmy. Can we give like a round of applause using emojis for that talk? Yeah, please just give a round of applause for Timmy. Timmy, thank you so much for that. If you have any questions for Timmy, can you please type them out in the chat and then put in brackets Timmy. So when you get to the Q&A session, Timmy will be able to answer all your questions. And now we're going to move on to our next speaker, and our next speaker is Bami. So can we give a round of applause for Bami?
Thank you so much, Timmy. That was really, really insightful and really motivational. I believe that we are really in a moment where Africans, I think, need to stand up in a big way and make an impact in terms of the use of AI and the improvement in innovation technology across the continent. And I think, that talk really showed us many things that were happening in the world, and how AI could really be an equaling factor for us in healthcare, on the African continent as well. So before any further talks, I just want to get a good idea of who is in the room. As anyone here, if you've worked on healthcare in AI before, just put up your hand. Everybody, to everybody in the room, if you've worked on AI in healthcare before, just raise your hand. If not, it's fine. You can just put your hand down. Okay, that's one. Okay, two. Number of people who worked on AI in healthcare before. Let me see. Okay, we see 4 hands up. Okay. Any more people? Okay, so about 4 people who have worked on AI in healthcare before. Cool. So we have a lot of fresh people who haven't worked on AI in healthcare before. So we're gonna We're going to jump right into today's talk. Before I move ahead, just let me know if you can see my screen. Okay, so sharing. You see my screen? Can you see my screen?
Yes.
Okay. Alrighty. That is super. So as Timmy said, at Eden AI, we believe that AI is a powerful tool, and that it's so powerful that it will transform every single industry, especially healthcare. And this foundational belief is what is driving the work we're doing today. Today we'll talk about digital healing, the rise of smart care. And my talk is really around how you can participate. What are some of the areas that healthcare is also being used currently, even from our work? And perhaps that can also give you insight. I'll also speak about the general healthcare landscape, so that for those who are very, very new to healthcare, they actually have something that they can take really tangibly as well out of this, in terms of what type of work they could do, where they could go, what the landscape is like, and maybe even organizations that they could approach for upskilling and jobs. And of course, that includes Eden AI. So moving forward, this in our ecosystem, millions of people are affected in Africa. This is really what is happening right now. There are many, many companies. I can't put out all the healthcare companies on the African continent right now that are busy with healthcare and AI. But for example, many of the popular companies like InstaDeep, I believe, is like one of the biggest success stories in Africa. They don't just do AI in healthcare, though. They do AI in a number of things, but one of the key researches that they do is like in proteins and protein structure, and they really do quite a bit of work on the healthcare side, and they were bought by a pharmaceutical company in Europe. I can't remember the exact place. I believe Germany. And since then, they've been working very well with this company. But still, such a powerful success story of what AI in healthcare, what is possible through the researches that they've done within InstaDeep. Another company that's really, really doing great work is Jacaranda Health. I believe this company really, it's based in Kenya. So InstaDeep is from Tunisia, Jacaranda Health is from Kenya, and Jacaranda Health is really spearheading many of the Gen AI use cases for reaching out to pregnant women and ensuring that people get, instant access to healthcare through AI. I believe they also do this not just through like WhatsApp messages, but also through SMSs as well. And they have this like aid response that they send to people in need. Another good success story is MDoc. MDoc is a very initially healthcare centered company that was working on a complete health platform where they gathered data and they had an app, but very quickly they they got quite a bit of funding to build out an AI that could help with, they call it MNCH in the healthcare space, which is maternal neonatal child healthcare services for women. And they did this not just in MNCH but in many other categories of health. Another one in Ghana is actually Minor Health AI Labs. I believe in one of the conferences we had earlier this year, they worked on essentially a voice to AI sort of interface where you could make a phone call to a number, and literally, it would wait for a while and then it would give you, an answer to your healthcare question, or to your question over the phone. That is like really, really interesting, really, really interesting application. Another one, of course, I'll leave us for last. 4 Minute Medicine is a company that we, Eden AI is part of the Llama Impact Accelerator. So we work with Meta we're in the Llama Impact Accelerator. So like they back us up with the building of a solution of ours. And one of the companies that we're working with there as well is 4 Minute Medicine. And I believe the work that they're doing is really, really good in terms of education and AI-based education. On our side, like I said, we building an AI clinical assistant. I'll jump into a little bit more details later. But that is essentially on the African continent. These is not an exhaustive list. There are many, many other companies that I thought about now. I mean, now and previously that we didn't include here, but it's to give you an idea that they're Africans who are really working in the AI space. It's not just a dream; it is a reality. And I believe that if we can excel in execution, we can really move healthcare, the global healthcare access in Africa forward, and really impact a lot of lives. And generally, how the healthcare system in Africa works is that things really start on a community health level. In South Africa, community health generally speaks to the public clinics, health clinics, but it could also speak to like certain like less involved non-governmental structure, sort of like healthcare services, social sort of services that are done. But in this case, of course, in this diagram, it speaks to that. This is from profmusa.com. Prof. Musa is also a very well-known researcher in the healthcare space in South Africa. But one of the things that that is here is that if you look at this diagram that's over here, the community and health level, the community level and the health posts are really on the ground. They like posts where people will go to get some health, basic medical services that they need at the point of care. Then the next level will be the health centers. These health centers are really also like public health centers, but they cater to a little bit more of the need, and they can help. In Hillbrow, I believe there's a public health, there's a Hillbrow health center there as well. Then there is the district hospital, which is like one of the very well-known one. Like for example, like if you go to Charlotte McPike, no, that's a referral hospital actually. But if you go to like Helen Joseph, or some of these are district hospitals. Then referral hospitals are like hospitals that you go for like a different sort of surgeries and so on. But essentially, this healthcare, they're all different. This hospitals, this sort of healthcare centers are all different, and above all of this is really the Ministry of Health that really monitors what is happening, the disease and the public health burden in the country, and tries to see how to ensure that the country's health state is okay. So they'll do these drives on and I hope people are understanding here, but they do these drives on like disease programs, and these disease programs in some way are funded by sometimes by the government, but most times external institutions also fund these programs. So you find companies like if you heard it early in the year, like USAID, CDC, holding out funding maybe due to what Trump said previously and so on. So as like cutting down funding from Africa. So these people really funded a lot of the healthcare work that was done in Africa. And so right now there's a shortage in funding, but still there are other funding that is not necessarily from America. I just put a lot of like American-based sources in general, but like global grand challenges is not just America, it's also in Canada, in like other countries around the world, Nigeria, and so on. These are this is the landscape really, and there are many, many other companies. You can speak about Bill and Melinda Gates Foundation, the Rockefeller Foundation, Wellcome Trust, Buffett Foundation. All of these companies in some way, or organizations, I call them companies, but I mean organizations. These organizations in some way contribute to the public health burden and help, meet WHO, very, very big one, help meet, the needs of the continent as it stands. So generally projects can be applied across these levels, and I want to be mindful of time as well. I just want to check with Shanice, how much time do I have left? I may not get into too much detail.
You have until 3 o'clock.
Until 3 o'clock. Okay, what time is it now? Okay, so about, okay.
20 minutes.
Okay, so essentially now, yeah, so this is essentially this healthcare landscape. You see, it's bigger than just one company. And usually a company working on its own maybe is doing that in private health, but now I showed you the public health sector, and then there are many different, pharmaceuticals, dispensaries, people who are like, involved, very, many different stakeholders in this, big circle. So for someone who wants to be in the healthcare space, there's many avenues to enter through. And the question is, in what sort of, industry, or like, yeah, you can say not industry, but rather in what sort of agency or organization do you want to like sort of participate in, and look at how you can get in through there. So then next I'll jump and I'll change to the other side of the world where many of us are like familiar, because I believe most of the people on this call will be from AI, from the AI space, interested at least in AI. Is AI, and what is AI? What is AI techniques? What is prompting? So in AI, we have something called models. For those who don't know, most people probably know this. Machine learning models. Machine learning is really the big overall bracket for all sort of deep learning and other types of supervised, unsupervised learning. There's many things around supervised learning, many techniques, and then Gen AI is really what in the past 3 years has really been coming forward as such a big movement and shaker in the space, because many of the things that we used to do with traditional machine learning, where we would do traditional machine learning, we would do statistical as well learnings. Many of those have been like, these days Gen AI actually caters for many of these types of old models, and the Gen AI, with some structuring of your data and like validation of your outputs from the model, you can get very, very reasonable and very, very good models coming out with very minimal work using Gen AI. So Gen AI is short for generative AI. And generally what happens here is that there is some training and some fine-tuning happening, with these large language models and now these small language models, but it is mostly prompt-based techniques. What do we mean by prompts? It's essentially text that somebody writes. It's like low code, no code. It's like barely any code, so when you use prompts and you type what it is that you want, just like when you're using ChatGPT, actually, that's the best way to say it. It just helps save time in development of these models. And so with this, it helps, if you don't have too much statistical knowledge, to be able to get to a good AI model at the end of the day. But it does need you to comprehend English. For example, you need to have a knowledge of English. You need to know how to say things, give instructions in a way that makes sense to the model, and it also needs you to have an understanding of what it is that you want, because like Timmy said, he said, AI, if you just put something in ChatGPT, will give you the wrong answers, but here you can actually get like quite wrong answers without you knowing, if you're not a domain expert. So this domain expertise is very important. Like, how much do you know of the topic that you are prompting or that you are predicting or sharing about? That is so important here. And so this is really why Gen AI has really come to the forefront. So without those limitations, though, people can build very, very quickly. And so you'd find that many people are building things quickly, and getting crazy amount of money for the work that they're doing, and even like saving time, saving lives, and helping businesses work more efficiently. So that is healthcare, and now we've spoken about AI. And so I want to target more to now what hidden AI does, because I believe it will give you a bit of a fresh perspective. Some of this is it's many things around our project, the work we've done, how we've moved forward. So I'm just gonna move forward here. So Eden AI actually is a South African startup. We are a South African startup removing information barriers to better lives. This is important because we believe that by providing people with better data, we can improve their lives, and easier access to data. Essentially, people shouldn't stress to get the data that they need to make a decision. And so we do this through, AI solutions. These AI solutions, for example, are mostly, are mostly in the natural language processing space. But we've also deployed, big data analytics solutions, and some of that I'll speak about right now. So, like we've got a proven track record in public health technology. We've deployed large-scale public health data applications across Africa, 7 countries, in fact. All those, flags there, like South Africa, Nigeria, Ethiopia, Madagascar, Botswana, Rwanda, Kenya. Yeah. So like we've done Uganda. Yeah, anyways, we've done work across those 7 countries. And then Gen AI R&D in production, we've had 4 Gen AI solutions running in production, and we've built using ChatGPT, we've built using Llama. Like we said, right now we're part of the Llama Impact Accelerator for our clinical assistant called Lulama, and this is like we're one of 10 startups that are in this program, and we're building out a solution with the help of Meta over the next 8 months, and probably even after that, that will help push forward South African healthcare. And then, so let me give you direct examples of some of these solutions that we've built in production. So firstly, Gen AI in healthcare. One of them is like Blossom Care. This, I believe, has had quite a number of like publications. If you just Google, in fact, before we started this presentation, I did a Perplexity search for give me the top 10 AI startups in South Africa. Or I think, yeah, I don't know if I said AI, I said healthcare AI, I can't remember. But we came up, and one of the things it mentioned was Blossom Care. Blossom Care is an AI chatbot for compassionate women. Is a compassionate AI chatbot for stigmatized women that helps, with getting them to, but firstly helps by reducing the mental burden that they have, but also connecting them to on-the-ground support. So for example, a 16-year-old or 21-year-old, let's not even say 21-year-old, but let's say more 16-year-old. This is like a real life case of a person. I can't remember her age, she may be 21 actually. Initially, I think I heard she was a teenager who just got pregnant, but her mom wants her to immediately abort the baby. So, a case like that, many women suffering from like stigma, and she's like 6 months pregnant, by the way. So like at this point, it can be, terminally dangerous. It can be dangerous, it can be life-threatening to take out the baby at 6 months pregnancy. And so connecting this kind of person to the needs of to an organization that can help meet their needs is very, very important. So that's the work we did with Blossom Care. In the next slide, it will speak a little bit about it. I know my audio is not on, but let me just see if I can quickly stop sharing and reshare here with audio for the slide. Okay. So just let me know if you can hear it. So I'm just going to move forward. So here you just see the audio will play of the lady speaking there.
AI tool is so that you can text it even when you don't want to talk to somebody physically, and it will give you responses on how to take care of your mental health. So sometimes you feel down. Some people say they feel suicidal, they won't kill themselves, but please do not do that. This AI, consider it your best friend. The Blossom Mental Health AI, consider it your best friend. You can text it. So for example, I texted it earlier and I told it, oh, I'm masturbation, pornography, I feel suicidal, my business isn't going well, I feel very down, like I'm more progressive. And he gave me responses. You know, he told me take a deep breath, right? And focus on the present moment. So when you feel the urge to masturbate, try taking a deep breath and redirecting your thoughts elsewhere.
So that is like at an outreach, or what do we call it? Yeah. And just speaking about the Blossom Care AI and how it can help these women. If you see all these women here, they actually specifically the cohort that we started with was sex workers. So we covering their face backwards. In all the pictures you won't see the faces of the people. The only people you will see is maybe the faces of the volunteers or the people on ground helping to reach out to these women and just helping and supporting them through this through the stigma and through the dangers that's involved with their profession, but also in some cases as well, also in the cases where women actually want to change and turn their lives around, directly helping them with that transition. So this is great work. And if you Google just Blossom Care or Eden AI, you'd probably see one or two articles, and some of them there are not us. I don't know, some people just wrote some articles with or like without our consent, but so is the internet. But you see quite a number of information of articles around Blossom Care. Another one we've worked on in the past is we're not going to put all of them here. It's just maybe not all the Gen AI has to be in healthcare. Gen AI can be outside of healthcare. But there's another one that we worked on, conversational AI for self-management, and this just did a lot of I'll just focus on the technicalities here. Did a lot of knowledge retrievals, increased engagements for the company involved, and it so like RAG and all those things were like involved here, and it was mainly for lifestyle modifications for the users involved. Next one I'll just go into is big data analytics. So one of the things we've done at Eden AI is, we've spoken about the private health space, this the small, medium-sized companies. We've spoken about people innovating in certain spaces. We've spoken about like community-based outreaches. But now I want to speak about governments, because governments are also looking for AI solutions. They're looking to build big data analytics solutions, and so the big data analytics in healthcare here, one of the things we've done is we built the national data repository in Ethiopia, and both national and central for Addis Ababa, and we've built even the national health data warehouse there as well. This involved like aggregated level report, but the importance of this, what makes this big data, is because you're working with an entire population of people. Addis Ababa is very, very populated, and there's quite a number of people. I can't even mention the number, but in terms of like I believe here we have the number of patients in Addis Ababa. The CDR that we worked on is 340,594 patients just in there, and for each patient you have multiple encounters, multiple visits, so the scale of the data can quickly become large. So generally you need a big data analytics system that can support this scale of data, provide analytics, and in a way that can lead to machine learning in the long run. So this was work that we did in Ethiopia. We've also done patient linking, matching and linking in Kenya. These are like real pictures. Also here in Ethiopia, those are like real pictures. Working with our partners to get this out to improve, the identification of patients. Usually I can go to a hospital now and go to another hospital later, but not provide my name the exact same way. And even if it's the exact same way, maybe they don't have a direct link of my records. The identification is quite an important thing to do. So that is well said. There's also a few other projects, but I think it's been like I don't want to continue. I believe like it's been a good sort of like sort of breakdown of AI in the healthcare space, like big data analytics, some of the work that can be done. I could have spoken more and more and more, maybe about more of our recent work and Lulama, because that's a really exciting project that is really an initiative for more context-aware tools on the African continent. But yes, I think thank you. I'll end it here. Thanks, Shanice.
Thank you for that, Bami. Can we all give another round of applause for? Can you guys see me? Okay, there we go. Can you please give Bami another round of applause for his talk? Thank you so much, Bami. We're gonna move right into the next talk, since we kind of finished early on the second talk. So I'm gonna invite Oselo, and he's gonna guide us through the Q&A session. So I noticed that we didn't put our questions in the chat. So if you wanna ask a question, okay, someone asked a question. So Oselo, you can take the first question in the chat, and then we can open up our mics. Raise your hand first, and then Oselo will.
All right.
Ask the question.
Thank you very much, Shanice. So I'll just be, like Shanice said, just facilitating the question and answer session. So the first question, and I'd also like to thank Bami and also Timmy for their two insightful presentations about what AI is, the impact of AI in Africa, and what Eden AI is doing in the AI space. So the first question that we have from Mohammed Farouk, what are the limitations and cons of AI in the health sector? And then the second question is, South Africa has a diverse culture and different races that medications differ for everyone according to the region of the person. Is this going to be a limitation? All right, so I'll start off with the first one, right? What are the limitations and cons of AI in the health sector, right? So one of the limitations that comes top of mind is in terms of privacy, right? Or rather access to good data, right? So the AI solutions are essentially powered by the quality of the data that you are provided, right? And then if we don't have a system where we can actually like collect clean data that is not messy and is not confusing for the AI to be able to extract meaningful insights from that, then that would be a limitation. And then also in terms of privacy, right? As I mentioned privacy. So like sometimes, like, we are limited by, in fact, not sometimes, most of the times we are limited by privacy in terms of the data. Data in the healthcare space is really, really important. And there are lots of red tapes in terms of the legislation that is governing how you can use that data. So if we don't have the correct policy to govern how we collect data from patients, then the solutions that we develop or that will use this data will be limited by the poor data that's given. And then also like if we are not disciplined in how we handle that data, then we can lead into a scenario where there might be spillage of information. But our jobs as AI specialists and machine learning specialists as well, and also system architects, is to ensure that we have a robust system that ensures that those type of scenarios where data is spilling into where it's not supposed to be is prevented. And then to the second question of the diversity of culture and how is that a limitation? Well, diversity essentially can also be flipped on the side of it being kind of like a strength, to the AI solutions, because like the more diverse the data that you have, the more insights that it can learn, right? And the more it can help you, it can help us, so like if we just have one single palette or type of pattern of data, then the solutions or the generations that we get will be just strictly to that pattern. But then the more diverse it is, then we can tailor solutions that we give to the diversity of the culture or the data that's present in the system. So that's the first question. Any Mohammed, do you have any follow-ups on that? Or it's fine. But okay, and then we have another question from Masi Bonge. Thank you for joining, Masi. When introducing AI tools in healthcare, how can we build trust among professionals, especially when they are skeptical and fear that AI might diagnose incorrectly, even when the tool is not intended for diagnosis, but rather for support? Right. So in the earlier talk by Timileyin, like you mentioned that AI, the solutions that we build with AI are essentially to augment the work that the healthcare professionals are doing and not to replace them, right? So the solutions are not there to say that, okay, now we have an AI assistant or AI tool, and now you don't need to see Dr. Shabalala anymore. You just have to sign on and speak to the AI tool. What we're coming here is we're trying to buttress the experience of Dr. Shabalala with his years, or her years, or rather, of training and upskilling, and then putting them together with this AI tool that can help them or augment the way that they provide their services or healthcare to their patients. So that is why we say that it's not here to replace, but then we also have to further, I guess, to alleviate that skepticism or the fear. Then it's also on us, not only the technical or the architects, but also the policymakers, to ensure that we are staying in the correct frame of augmenting and not replacing healthcare specialists. So yeah, that's to the third question. I hope, Masi, do you have any comments on that before I move on to the next question? Or any? Okay. I'll just wait for 1 minute and then I'll move to the next question from Onyinye Sarah. I'd like to know more about what health and safety parameters govern your Gen AI chatbots, especially because they are crafted for a vulnerable demographic. Are there parameters in place to make sure it is never giving responses that will actually be harmful to the people it interacts with? All right. I can take that. Okay, so
I can also contribute to that.
All right. Do you want to go for it?
Yeah, actually, now I'm thinking that maybe if Betty is on the call, yeah, maybe she can take it. Yeah.
Thank you.
I beg your pardon, but can you repeat the things?
Okay, so the question from Onyinye is that, are there any guardrails that we are putting in Blossom AI to ensure that the responses to the vulnerable demographic are not actually harmful to them when they interact with the Blossom healthcare bot?
Yes, we implement threat timing. So even if, the user attempt to ruin the prompts that we done at the back, and if they want to, yes, we all know there are like malicious people, so we try to prevent those situations by adding different kinds of tools to prevent the system without having been harmed by people's, also harmful for other people's. If you ask Jenny or Lucent Care bot about sports and other stuffs, she will only interact with you what you are feeling besides those questions. If you're saying I'm feeling happy, I see a football today, I'm doing this, I'm doing that, and she will only consider what are you feeling by watching football. What is your mental state now? Like she's focusing on, I'm sorry, I call her she because she's tutoring for women, um so let me make over it. Okay, we make two ways of not authentication but preventing those kinds of situations. If someone want to harm, some people want to harm the system, we have a defense mechanism, and we have lots of authentications and other stuff behind. And if we think if a person is, if the bot, if you guys concerned with if the bots try to harm the person's feeling, we train them in a way that nurturing and good for the peoples and thinking about their feelings rather than telling them other stuff like the way that the user wants it. If a user talks about politics or sports, she'll only consider about their feelings besides what they are talking about. So this is what I can.
Yes, I can just add on to that. So one of the really good thing about us being like really central to, very close to the Meta Llama teams, is that we get direct support on actually most of our, okay, of course we use ChatGPT as well. Like OpenAI models, but we use a lot of Llama models. And for our Llama models, because we're so close to the team, we have direct access to the best in I guess in-house sort of like tools for guardrailing models, and we're always implementing or looking to implement the most up-to-date in-house guardrails. Llama, for example, provides multiple guardrails for different things, prompt injections, or like harmful responses, and some of them we've implemented already, but generally we always look to implement them across all our models to ensure that they are safe for use to the people before they are deployed. One of the big things is also that we do is that we also monitor the chats, well, not us, but the not us directly alone, but the Blossom Girls Outreach Foundation, the foundation on the ground working with the women. So they monitor and they try to help and intervene, create interventions where really necessary for each one of these vulnerable groups. And it's well said that vulnerable groups need extra support, extra help, and so that's also why we're building these chatbots so that they can help reach these women or even these groups a lot better than any one foundation would on its own. Cool.
Thank you very much. Let me thank you, Betty. As to Onyinye's question. So that was a final question on the chat, but please feel free to just unmute if you have any further questions. Great. One from Dr. Motsele. Given that most AI training data sets rely heavily on Western medical literature and patient populations, what specific technical approaches are you taking to adapt your models for African healthcare contexts? Right. So you're particularly interested in the location of the data, accounting for genetic diversity, endemic diseases, and also different clinical presentations that may be underrepresented in global data sets. And lastly, validation methods. Okay. Sweet. Let me take this. Right. So for the African healthcare context in terms of when we start speaking about Western medical literature, right now, we're not essentially the solutions that we're building are not essentially trying to prescribe, if that's the right word, treatments towards for the patient. Rather, they are assistance in terms of guiding the doctor in terms of during the consultation what was essentially mentioned, and then in terms of the data localization, when a condition is mentioned, it will pull up a resource, or it will try to pull up a resource on a what is it called now, a local document called the standard essential medicines list, which is essentially something which is a document that doctors would be well versed in here in South Africa. So it's not necessarily trying to prescribe diagnosis using Western medical literature, but the literature that it has access to is from South Africa for now. And then in terms of accounting for genetic diversity, we're not entering that space right now in terms of like trying to prescribe based on maybe a patient's genetics condition, or in terms of endemic diseases. Right now, it will be essentially trying to assist the doctor in getting the where the resource for this, how to treat a specific condition, and then the doctor would then use their own knowledge to take it further to give a diagnosis. But Bami, I think you have your hands raised up to further answer this very good question.
Yes, I really like the question because it's thinking from an African perspective, and I like the important point of localization. So one of the key things of the work we're doing is the word context-aware tools, tools that are aware to our local context, and that really speak to what it is that we're doing. And so I mean, when we're building, we're not just building for the now and like once it's done, it's done for good, everything is happy, everybody's happy. No, it's always a continuous process of research and iteration. One of the key, like we engage with many people, and one of the key researches that we were really interested in, and we've been speaking to the people involved in that research, was the research that was done on it. You'd find it very interesting now on the localization of healthcare advice by AI models. So, for example, the person took like a number of models and like different AI models, and said that just on a normal day, asking this question without any other like jargon about like a specific country. So there's like certain keywords. So like what is the majority medication used in Nigeria for malaria, for example, or used in South Africa for TB, or the most likely medication, that kind of thing. And generally the AI will answer with an answer, and each one of those models will answer with different answers. And they would even like test, for example, when you don't specify anything whatsoever and you just specify as limited information as possible. When you give the model, let's say 4 options, you say like chloroquine, you say bitter leaf, you say, something else. And then you put that as the options and ask the model to choose one. Which one does the model choose? Because that explains like the bias of that model, right? So in doing that kind of research, what you can then see is that per model, each model has a certain bias. And like in terms of traditional medicine versus like, in Nigeria, for example, to treat malaria, you would use bitter leaf. That's the most used thing. But the AI may not know that. So like in essentially understanding the biases in the models, to provide, even like healthcare information and all of this is really important to be able to know what uses the models can best help with. In our case, mostly we're aware of many of this, and we are always like doing research, because more and more research is important for the ability of these tools to be used in healthcare spaces, most especially. But we also try to like fine tune on like reality, like Oselu said, getting actual things that doctors use and putting that in their faces, rather than coming up with something new, and also like focusing on rather than diagnosis, that's like such a touchy subject, focusing on other things that could still be helpful and really improve, like the work we did with the government in Ethiopia, like really like just improved. It didn't have anything to do with the doctor, but was improving program planning. That is a big add that AI can do. So I think I'm understanding that AI, can be used across these different, in these different ways. There are many, 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 many ways to use AI. And so, and also then also, of course, being like very, very careful about, its deployment, and so on. For example, we are part of many regulatory, for example, our company is part of the COP health AI regulatory group, and that's like one of the biggest regulatory groups in Africa, and we see it as an important step um, to ensuring that all the models, everything that we're building is grounded in regulatory, in compliance, in like the best ethical, because it's of importance to us. So I think yeah, so I think I've really drummed on this quite a bit, and I've given like a lot of different like views, but also Selu like mentioned quite a number of things. But yeah, we're thinking very, very strongly about many of these topics. Thank you.
Thank you. Thank you. Thank you, Bami. Thank you for that question. Thank you. Okay, so that covers most of my question. Are there any more questions on from the audience? Or if not, I might have to pass it back to Shanice. Any questions on AI, machine learning, data science, big data analytics, some of the work that was mentioned in Ethiopia, the rest? Okay. All right. All right. Thank you very much, guys, for this. This was quite a wonderful Q&A session. I'll give it back to Shanice. Shanice?
Yes.
Yes.
Okay, that was quite a short Q&A, but can we just give a round of applause for all the people who asked questions and all of the answers? So let's just drop a few emojis. Thank you for everyone who dropped an emoji. So I think this is where we get to the part where we announce the winner for the giveaway. Oh, someone raised their hand. You may speak. Or is it in the chat? Mr. Lay, you may speak. Oh, okay, sorry, it's all right. Yes, okay, sorry about that. So now I will announce the winner of the voucher for the Rocco Mamas, and the winner is Musale. I'm not sure if I'm pronouncing it correctly. Musale, yeah, you're the winner. So I'm going to email you, and then I will send you the voucher for your Rocco Mamas meal. So let's give her a round of applause. Thank you for participating, and thank you for all of your questions. And I'm just going to hand it over to Bami for 2 minutes so that he can just give us a brief of Lulama, just to go over it again and what we have planned for Wednesday.
Okay, thank you, Shanice. I don't know if it's my network. It may be my network. I think I'm like lagging a bit. So, yeah, I will still just give me a second, Shanice, while I get ready to speak about Lulama. Thank you. All right. So about Lulama, Lulama, I mean, of course, in isiZulu means to get well. And it's our way of saying that we want the healthcare system in Africa to get well, you know. And with Lulama, we are essentially just over the next few days, actually on Wednesday next week, we'll be asking people to to come through to certain stations where we've gotten some medical doctors to be situated, and different practices and so on. And we'll be providing like free healthcare, standard healthcare screening, um, and also, like, I guess, some packages as well for people who will be joining the event. With Lulama, again, it's not a tool that is for people directly, but it's rather a tool that is used by doctors. And so we are inviting, everyone on the call who can, make it to some of these locations. Of course, we can send some details to come and, participate. Come get some free medical screening with some goodies at the end of the day, and to like, if there's anyone that that is in need of such services, please do. Of course, like, as we've said, we're always thinking deeply about the work that we do, so we ensure that it's also in line with all the regulations. So of course, like, the processing of your personal information is also important. We will, like, tell you, like, hey, please, like, this is how we're going to use your information, this, and this, and this, if we will use it at all. But yeah, I think that's just it. Lulama, we're going to have this happening next week, Wednesday, on Heritage Day. And yeah, we'll be inviting you guys to come and participate in the healthcare screening, the free healthcare screening. And yeah, we'll be giving some goodies as well. So thank you all so much. Back to Shanice. I believe we have one more thing to do.
Thank you, Bami, for that. I will be sending out emails, and just check out our social media pages for any updates on that. And if you would like to come, you can just email me back, because I've emailed everybody. So if you want to ask any questions, you can email me back, and I'll answer any questions that you have for the day in terms of transport and more information. Um, you can email me and I will respond. So I have put a feedback form in the chat, and I'd just like to ask everybody to just give feedback on the event today so that we can, improve going forward, because we will be having more of these events. And if you have any more questions, or you want to add value to what we had today, you can just put it on the feedback form. And yeah, that's pretty much it for today. I'd like to thank everyone for being here today and taking time out of your day to join us. And I hope we all learned something new. And yeah, thank you for joining. Please don't forget to fill out the form. It's just like 5 questions at the most. Just fill it in so we can, improve our events. Thank you, everybody.
Thank you.